The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm Shay Paul, and I am being joined by Dr. Jared Chapman of Living Well. Dr. Chapman, it's great seeing you.
Great to be here today.
I know one of the procedures that you have told me that you get a lot of patients for this, and that is laser hair removal. Can we discuss that a little bit more? I mean, first of all, when would a person know that they might need to seek professional and not just over-the-counter methods for removing hair?
Well, the over-the-counter methods for removing hair are somewhat caustic to the skin. The depilatory products that you buy over the counter can irritate and burn the skin. So if someone is using those, and of course they're probably not going to use those on their face, but they're going to use those on their body, it has to be done frequently, and again, it can cause irritation. What we find is patients who seek laser hair removal are either having excessive hair growing on their face, around their chin and their lip, or they just don't want to shave anymore. They want to have that prolonged time of shaving your legs or shaving your armpits, or for men it's usually their backs. It's difficult to shave that area. You have to have someone do it, so it's more of convenience and more of time restriction. And then there's the cost of shaving. You have the razors that are outrageously expensive anymore.
So much so that they're in a locked case, right?
That's right. And if you get good ones, that's where you're going to get them from, so they don't irritate your skin. So those are the reasons mostly. And also there's irritations from the shaving. So a lot of times people get a lot of ingrown hairs, and they get a lot of painful rashes from the area that they shave. And so it's just nice. This is an easy, quick, safe way to get rid of unwanted hair. We want to really speak to who is a candidate. The lasers we have will target all skin types. So meaning from a 1 to a 6, meaning from the lightest to the darkest person, we can treat. So skin type anymore is not an issue. What is an issue is the color of the hair. So if someone's seeking laser hair removal, you don't want to go spend money for blonde hair. The lasers are not there yet. They're not going to treat blonde hair. They're not going to treat gray hair. They're not probably going to treat really good light brown hair. You want dark brown, dark red, or black. And those are the 3 colors of hair that you want, that you can accomplish great results with laser hair removal. The procedure takes anywhere from maybe 2 minutes up to 30 minutes, depending on the area treated. The number of treatments, of course, are dependent on the individual. So we usually say 6 to 8 treatments will achieve permanent hair reduction, which is 90% of the hair removed in a particular area. And then we do say about once to twice a year, you come in for a touch-up treatment of the area you've had treated with the laser.
Okay.
There's little to no downtime with the treatment. So, it's quick. There is maybe some irritation of the follicles about 5 hours to maybe 6 hours after the treatment. The hair follicles maybe get a little tender, but mostly it's pretty much benign. There's no downtime with it. You can just come and go. You don't shave the area. You don't pluck the area or tweeze the area, as my wife would say. We pluck chickens and pluck turkeys. We don't pluck people. So we tweeze. No tweezing of the area prior to coming in for treatment. But you can shave it off to the surface of the skin. That's fine, because the laser targets the pigment in the follicle. So as long as the hair is still intact in the follicle, then it will accomplish the treatment.
I see. Okay.
So it works by sending that heat. The laser is attracted to the melanin in the hair follicle, and that heat is transferred down into the bulb of the hair follicle where the blood comes in to feed. And so basically that heat then cauterizes or seals off that blood vessel and allows the hair follicle to shrink and die, and then the hair quits growing. So that's laser hair removal 101 in a nutshell.
Well, thank you. I never knew exactly how it worked, to be honest with you, but that makes sense now with why it doesn't work on light hair, because it's attracted to the melanin, and there's little to no melanin in light hair, right?
Or gray hair.
or gray. I wouldn't know anything about that, but.
Me neither. Me neither.
Well, Dr. Chapman, if any of our viewers out there would be interested in a consultation, I know that they can certainly give one of your locations a call. And as always, we appreciate you being with us.
Thank you so much for having me this morning.
Sure.